Welcome back to the show. Today is Medical Monday, and joining us in studio this morning to talk about Breast Cancer Awareness Month, we welcome Dr. Suzanne Law, who is a general surgeon and breast surgeon, to the show. Thank you for taking the time to be here.
Thank you for having me.
Yes, an important topic to talk about as always, but October is Breast Cancer Awareness Month. Let's start with this. Talk about the main surgical options for treating breast cancer for patients today.
So the main two options are lumpectomy, which is actually called partial mastectomy, where we just remove the tumor in a sort of a safety zone of normal tissue and preserve the rest of the breast. And then mastectomy, where all of the breast tissue is removed. And which one we do is dependent on how much of the breast tissue is involved with cancer compared to the overall size of the breast. So we're using a lot of new techniques to try to preserve as much breast tissue as possible whenever we can, even using plastic surgery techniques like breast reduction, so we can remove larger tumors and still preserve the breast.
Well, and talk about how you will guide patients through this process and what option is best for them.
Well, I always start by explaining about breast cancer, because when you understand something, it's easier to deal with. And then I even sometimes will show them their films and show them how much of the area is involved and what's going to need to be removed. And sometimes that helps someone accept that decision. It's usually my decision to be able to tell them if they can have breast conserving surgery, but some women choose to continue on to mastectomy. Whatever they need to feel confident and comfortable going forward with their life is important.
Well, and back to some of those new innovations. Hurley is using some newer innovations in breast surgery that have been developed to make it less impactful long-term for patients. Why is that so important when it comes to considering their quality of life?
Well, because breast survivorship is such a big topic. It's so important because we are able to cure a lot of breast cancers now. And so trying to make it less of a disruption to their life will help them to be able to put it behind them and move forward. So some of the great innovations we have are ways to decrease that impact, such as with nipple-sparing mastectomy, which is a great technique. The one unfortunate consequence is loss of sensation. So with tissue-based reconstruction, we can sometimes, we already have techniques to restore that, but now we can do that with implant-based reconstruction as well by using a nerve conduit to allow that nerve to grow back and reconnect to the nipple-areolar complex and restore sensation.
That is fascinating. Bottom line, though, it sounds like, again, patient is top of mind here when it comes to making a difference in their lives. What does that mean to you, considering what you do?
Well, what's important to me is that I always tell my patients taking care of breast cancer is 50% taking care of the cancer itself and 50% taking care of the mental, the spiritual, all of those emotional impacts that breast cancer has. It's a very emotional cancer. And in order for someone to be a true survivor, you have to deal with all of those things.
Of course. And then quickly as well, talk about the importance of self-examination. And again, this can impact men as well.
Yes, it can. So it's really important for early detection. We can alter some things and decrease our risk. Most importantly, things like quitting smoking, eating healthy, and maintaining a healthy weight, which all reduces our risk of any kind of cancer. But we can't change our genetics or family history. So the next best thing to prevention is early detection. If we can find it when it's small and confined to the breast, the survival of stage 1 breast cancer is 98 to 100%.
Well, that's encouraging. That's certainly encouraging. Again, our thanks this morning to Dr. Suzanne Law with some really important information during Breast Cancer Awareness Month. There's more information on your screen as well with the website you can go to with any further questions. We really do appreciate your time and your insight this morning.
Thank you for having me.
Thanks.